Welcome back. Welcome back. This is the People's Voice. I am Trey Evans, and I am the People's Voice. Thank you again for checking out the podcast this week. As always, it's greatly appreciated. As always, we thank everyone who has taken some time to listen to the podcast today. We do understand that you could be utilizing your time to do something else, so we are appreciative that you're spending that time equity with us. As always, if this information is valuable, you feel it to be enlightening and worth sharing, we do ask that you subscribe to the podcast and turn on notifications. That way you'll be notified when each episode is released. We do put out an episode each and every Friday, which can be heard on all podcast platforms. And we also put a video out on YouTube every Wednesday as well for those of you who would like to watch the podcast. But as always, we thank you and welcome to the People's Voice podcast. So today, I want to get into the topic of hospitals. And specifically, I want to talk about hospitals that are closing here in the United States. There was a story recently that came up, and this has been covered from the national news side of it, but I kind of wanted to dig a little bit deeper into the story. But recently there was a story of Stewart Healthcare system, and Stewart Healthcare basically operates and owns several hospitals across the country. And they have recently come out and filed for bankruptcy protection because it's been reported in the story that they need to basically cover about $9 billion in total liabilities. That's just bills, y'all. That's just bills. And so because of that, they filed for bankruptcy protection, and now, of course, they'll start that proceedings. In this, one of the reasons I wanted to cover it is because this is a snapshot of some of the challenges that are occurring across the country when it comes to not only just healthcare, but hospitals specifically. Hospitals are closing, and I don't know how much people know about that. And so I want to talk about, talk about this bankruptcy a little bit. I want to talk about some of the reasons why hospitals end up closing and the areas that they're closing in, and then talk about, kind of some of the effects, the ripple effects when this happens. So Stewart Healthcare, again, like I said, they're basically filing for bankruptcy. They have about 31 hospitals across the country. Just looking at a map of some of their hospitals, because I pulled it up, and they have hospitals in Arizona, Arkansas, Florida, Louisiana, Massachusetts, Ohio, Pennsylvania, and Texas. So they've got a pretty good mixture, mostly in the southern region of the country, but throughout that region or throughout that footprint, it covers about 31 hotels. Now, in this bankruptcy filing, they have said that they're filing for bankruptcy. And let me just read their quote directly. I'm actually reading an article here from CNN Business. It says, "Our goal remains that there are 0 hospitals closed on our watch." This is an attorney for Stewart Health. He says there's going to be a change in ownership in many hospitals, and we recognize that, but we don't want to see any of these communities fail to be served. And that's an interesting line because, not often, but it has been reflected that when many of these hospitals close, oftentimes you're dealing with individuals in certain income levels and, of course, certain ethnicities and races that are typically affected by these types of closings. But I wanted to kind of address, or at least discuss a little bit, what causes a hospital to close, right? Because of course, we all think of a hospital, kind of probably the same way people think about houses of worship, right? It's like, well, it's a fabric of the community. Obviously, hospitals provide a valuable service. So why would a hospital have to close? So I started to do a little bit of research, and I came across this report that was done by the who was this done by? This was a report done by the Center for Healthcare Quality and Payment Reform. And really the report that they did was focused around rural hospitals, because rural hospitals, and when I say rural, I mean basically outside of the city, have been closing at an alarming rate over the last decade, which, is getting some type of report, but, not getting, in my opinion, a lot of light. But in this report, they kind of highlighted some of the reasons why hospitals end up closing. Now, it all comes down to this, let's not even,
Men lie, women lie, the numbers don't.
So I don't even want to, we don't even have to debate that. It all comes down to the money, to the numbers, and it comes down to money. But what specifically is causing it in terms of the money, right? Basically, I wanted to talk what's specifically going on. So in this report, they kind of highlight this. So one of the first things, and again, they're talking, this report was put together for hospitals in rural areas because this is where the occurrence of closures has been occurring the most. But all hospitals are dealing with many of these aspects that I'm going to cover here. So one of the first things that they say is that, hospitals end up closing or are unprofitable because they lose on patient services. And when they lose on patient services, it's because the primary source of revenues for most hospitals is payment services that they receive from health insurance plans. And health insurance plans, depending on the hospital and how that reimbursement is negotiated between the hospital or the hospital system, can vary, right? So you can have urban hospitals that receive a ton of money to cover all of their expenses and even provide them with profit. And then in some cases, you may have many rural hospitals who are not being reimbursed at the same level. Matter of fact, let me play this clip from Harold Miller. He's a CEO of the Center for Healthcare Quality and Payment Reform, and he conducted an interview with More Perfect Union. So let me play that so he can kind of explain it, and then I'll continue to go from there. But this is kind of the disparity between how hospitals are being compensated from an insurance standpoint.
The tradition in America for many years has been that healthcare providers and insurance plans negotiate to determine what's the right amount to pay. And the challenge is that bigger hospitals are in a much better position to negotiate with a big insurance plan than a small hospital is. So in many cases, the insurance plan says, here's what we're going to pay you. We're not negotiating. And so rural hospitals are increasingly now facing greater losses because their costs have been increasing, and the payments to be able to address those costs have not been increasing.
And that's, again, Harold Miller. He's a CEO for the Center of Healthcare Quality and Payment Reform. But as he said in that piece, smaller hospitals are not reimbursed at the same level that larger hospitals are reimbursed at. And it has a lot to do with volume, because bigger hospitals obviously get more patients. And then, of course, like he said, at peace in terms of the negotiation for what hospitals will be reimbursed for, bigger hospitals kind of have that leverage because, of course, they have more customers or patients, right, to be a little bit more subtle with it. And so therefore they can kind of negotiate some of those needs. In the report here, and I'll just touch on it really quick, they kind of broke it down in a graph where they talk about the median margin on patient services. And in this, in terms of, basically what the profit is, for many hospitals, it says 2/3 of small rural hospitals lose money delivering patient services. In 2022 and 2023, the median margin on patient services for rural hospitals was negative 7%. At the majority of hospitals, payments were 7% or more, 7% or more below what it costs for them to deliver the service. So basically, they were providing services at a deficit. It then goes on to show that in 2022 and 2023, the median margin on patient services for larger rural hospitals was at 3.5%, and at urban hospitals, it was almost at 6%. Most larger hospitals were paid more than it cost them to deliver services. So when they're paid more than the cost that they provided for the services, that's called profit, ladies and gentlemen. And so, not to be trivial with it, but that's one of the reasons why hospitals end up closing, especially when you start dealing with hospitals that are kind of on the outskirts of urban areas. It's a detailed report. Of course, I'll put this information in the links for the video, but just some other topics that it touches on. It says inadequate private insurance payments, which we kind of touched on a little bit. Many hospitals don't get the same amount of reimbursement. It also says that they have a higher cost for delivering services, which is kind of interesting because many people may think urban hospital or city hospital, I shouldn't just use urban, but city hospital, downtown hospitals, you would think, well, it probably costs them more money to deliver services because they probably have more money, so they have more higher grade of technology and things of that nature. But the cost of delivering services does not just include the equipment that's being used. It also requires personnel. And so, one of the issues is that, especially with these rural hospitals, is that they don't get the same volume of I want to say clients, but the same volume of patients. And so what ends up happening is that you have staff that's being paid, right? But they're not being utilized at the same level because they don't have that influx of patients. And so money's going out to pay staff, money's not coming in to reimburse staff. So that's where you get the higher cost of delivering services. It goes on to talk about relative cost and also, dependence on government funding, which has definitely been cut in many different ways, Medicare and Medicaid, things of that nature. One more thing that I wanted to point out here, it says that, it's kind of to reiterate, but this makes a huge difference in terms of what urban hospitals charge. And I talked about this just previously. It says most urban hospitals charge more than 4 times as much as it costs them to deliver services. As a result, they can provide large discounts to private insurance plans and still make significant profits on their services, right? So they can basically charge you and I, 4 times the amount what it costs, and then go to the insurance company and say, well, we're going to get, this amount from the patient. So y'all can charge us this lower amount because, we can cover that. And then, you get that, what they call a volume discount in business. But going a little bit further. So why am I talking about this, right? Hospitals are closing. It's been estimated in this report that Well over 100 hospitals have closed in the last decade. Some even have estimated that, it's possible that another 700 rural hospitals are at risk of closing. Another 30% of the 700 rural hospitals are potentially or in danger of closing. So why am I talking about this? Well, what ends up happening when these hospitals close, especially on the outskirts of big cities, you then obviously need a center that can treat these, patients, treat people. So then you start to get an influx of people, not only that you have to deal with obviously the larger population within the cities, but now you have individuals coming from outside the cities to receive treatment. There was a story on NBC News where they talked about the strain that's currently being felt in Atlanta's healthcare system. And the reason for this is that there have been rural closings of hospitals in the Georgia area, but then you also had a major hospital that was located downtown in the historic, where I'm reading this here. It was located downtown, and I'm just trying to pull the name of it. The Atlanta Medical Center, once known as Georgia Baptist Hospital, ended up closing back in 2022 because of financial troubles. And I'm using this as an example because what ends up happening is that when these hospitals close, this puts pressure on everyone, especially for those hospitals that are located in cities and in downtown and urban districts. It goes on to say that the hospital closed as of 2022. It was acquired back in 2016 by a nonprofit organization called Wellstar Health Systems. But when this hospital closed, it now puts pressure on the hospitals around them. And I wanted to play this clip from 11 Alive where they talked about, because after this hospital closed, what ended up happening is that there's a hospital called Grady Memorial. Grady Memorial ended up dealing with, basically the influx of patients, and, they've been struggling a little bit. So let me play this piece here, and then I'll close out from there. So this is from 11 Alive, talking about Grady Memorial and the pressure that they felt from these closings.
It's been 2 months since Grady became Atlanta's only level 1 trauma center. And today, hospital leaders shared how they had to spring into action quickly to meet the needs of patients. That action plan included not turning away any trauma patients. Hospital leaders shared that as the city's only remaining level 1 trauma center, it is Grady's responsibility to see those patients, so the hospital will no longer go on trauma diversion. Diversion happens when a hospital is overloaded and cannot accept ambulance traffic until there is more space. Now, new numbers from Grady show the uptick in need. The number of trauma patients treated at Grady increased 20% since this summer, and the hospital also seeing a 40% increase in babies born at Grady, plus an increased demand in NICU care. Hospital leaders say Wellstar AMC previously provided a lot of OBGYN services, and now a substantial number of those patients are coming over to Grady. Now,
and as you heard there in the report, they have an influx of patients, and this was from back in last year, because AMC closed in 2022. But that effect that was reported in terms of the increase in the number of patients going into the trauma unit, deliveries that increased for natal care and newborns and things of that nature, this puts tremendous pressure on the healthcare system, and many hospitals across the country are feeling these effects. So I kind of wanted to just talk about this today. Now, of course, what can be done, right? Because you guys know I just don't like to talk. This kind of has to go back, and somebody accused me of being what do they call me, a voting blue or something like that. And I've said it a million times, I'm not Democrat, Republican. I don't care. I'm in the people business. And so what has to happen is that there has to be pressure put not only on the local officials, but definitely on your state officials as well, to put pressure on these insurance companies, and also better legislation or more adequate legislation that provides proper funding for these hospitals, so the healthcare network doesn't receive this much pressure, especially from a local perspective. Now, obviously, that's not an overnight thing, and this is not going to be stopped in any time soon. Their hospital closings are currently going on, and they're probably going to be more throughout the year. But I think from a conversation standpoint, it needs to be highlighted the effects that it has on not just the rural areas, but what it will have on the entire healthcare system for the region. Because for Atlanta to have just that one hospital now, basically, well, at least in that area, to serve that many people, puts a lot of pressure on that area, and really puts healthcare into danger with potential malpractice suits and things of that nature. So, a lot of conversation and legislation has to be passed, pressure on those insurance companies to provide better reimbursement plans to hospitals so they don't have to close at the rate that they've been closing at. But that's what I wanted to talk about today. Like I said, I saw this story pop up, so I thought this would be a good time to kind of, dig a little bit deeper into what's causing hospitals to close, and even in the case of Stewart Healthcare Systems, why they would have to file for bankruptcy, for their hospitals, to save these hospitals without having to close them. So that's my time for today. If you want to leave a comment and give me some feedback on this, feedback is always welcome. You can reach me on any of the social media platforms. I'm at I am Trey Evans on all social media platforms, or you can reach us at the People's Voice Podcast on Instagram, and of course the YouTube channel. Been getting a lot of comments over there lately. So, and as you guys know, I respond to them all. So, but that's our time for today. As always, dreams are not just for sleeping. Please wake up and live your dreams. My name is Trey Evans, the People's Voice. Tell somebody about the dream. Salute.